Hi guys, I'm back. Firstly, thank you very much for all your good wishes. I really appreciate them. I'm much better. It's just the breathing. I've just come up the stairs, so I'll be a bit panty, so do excuse my panting. I'm here because a lot of people have asked me to do a vlog on lungs. I am a sufferer of a chronic lung disease called hypersensitivity pneumonitis. No known cause, no known cure. It's been 5 years, which is quite mad that right now with the COVID, that it's all to do with lungs, which I'll go into in just a bit. This, I believe, was caused by a virus that I had 5 years ago. One day I was out on my birthday, I couldn't breathe. Everyone was like taking the mick going, come on Missy, keep up with this. And I was like, then I had temperature, I had fever, cough, shortness of breath, everything that, you know, COVID is, I had 5 years ago. After that, I was told I got hay fever. I was given lots of hay fever things. I was given scans. No one knew what was wrong with me. Then they put me, I was hospitalized. They put me on steroids. Steroids caused lots of problems, caused diabetes, high blood pressure. And in the 5 years that they were pumping me with drugs, they scarred my lungs because of inflammation of the lungs, and they don't know what's causing it. So I've had to live with it for 4 years. Okay, so, and also I suspect I had COVID a week ago, you know, when I was ill. And I was petrified because I am a vulnerable person with underlying health conditions. I kept saying to my mum, if this happens to me, I will be dead. But, you know, thanks to God, thanks to the universe, thanks to my angels, they looked after me, and I'm here to tell my story. So I like to talk, and I don't want to keep talking and talking and talking. I want to give you my 2 pence worth, okay? Like I say, I am not a doctor. I'm not anyone in the medical profession. I'm a patient of lungs, and I've had to deal with this in the last 5 years. I'd say 4 years. 5 years. 5 years. I was diagnosed 4 years ago, but it started 5 years ago. Long story. We'll go into that another time. So, things that I think that you need to do once you think you've got symptoms of COVID, which is fever, cough, shortness of breath. Number one, if you get the fever, okay, my advice is this. Lots of people, when they get a fever, they go, oh, there, because someone's like really shivering. Put a duvet on them, put a blanket on them, keep them nice and warm and cozy. No. Take off their clothes, put something really light on, light clothing, or, you know, if they're able to, no clothing. Open the windows, put some fans on, get that fever down. Paracetamol every 4 hours, okay? They say 6 hours, I say 4 hours, okay? And don't keep over checking the temperature. That's number one, okay? The temperature is going to come down with nice fresh air and cooling the air as well, okay? What else? Have a box of tissues by that person. Every time they cough and sneeze, cough into the tissue, get rid of it. What else? Keep the environment clean. So I have like a air purifier in my house, which takes out all the little particles from the atmosphere, and then you can use a air humidifier, which allows steam into the air, which is very good for your lungs, okay? Don't share towels. Have your own towel. Keep your environment clean, keep your hands clean, wash your hands, all the usual stuff, okay? So whenever I come down with infections, that's what I do. Don't go too near anybody. Keep hydrated, drink lots and lots of water. Hot water really helps with coughing, sore throat, phlegm. Lemon and honey is good. If you want to take it a step further, and this is really good, is in a what do you call them, in a pan, put a couple of pints of water, grate some ginger, puts half a teaspoon of turmeric, what else, chop half a lemon, squeeze it in there, chuck it in there, and let it boil, come to a boil, then reduce it, and then just let it keep boiling very lightly for a bit. Let it all seep together, and then pour it into a glass and then add some honey, manuka honey, raw honey. I use raw honey, any kind of honey. It's not the most pleasant thing to drink, but I promise you it will really help with inflammation of the lungs. Food, eat light. Try, please, not to ram that person with lots of sugar and processed food. Light foods, good healthy foods if you can. Light soups, chicken broth, that kind of thing. Boiled rice, bananas, potato, boiled potato, jacket potato with just a bit of butter and salt, that kind of food. No dairy. Dairy will cause phlegm in your lungs, which will block it all up, and that's what COVID does. It kind of it ingests a lot of it creates a lot of phlegm and mucus in your lungs. So I would keep away from the dairy if you can. Okay. What else? Coughing, phlegm. When you're coughing, try not to swallow the phlegm. Apparently it's not bad, but it's not good either. Okay. They go down a different tube. Once you have phlegm in your throat and you swallow it, it doesn't go down the tube that it came from. It goes down the one that goes down to your stomach and can cause a burning sensation. So you can swallow it, but I always say the better if it's better in than out. Sorry, better out than in. So if you're coughing phlegm, cough it out. If you can, in the sink, toilet, whatever. Otherwise a tissue. Don't try and keep your cough tissues and mucus tissues in the room so much. Try and keep refreshing that bag because it comes out into the atmosphere. Yeah, so cough out that. Anything in your nose, try not to sniff it up, sniff it out again. It's better out than in. This is a lot of stuff that I learned when I went to pulmonary rehab. Okay. At pulmonary rehab, one of the biggest things I've learned in my life, which was amazing, was breathing, nasal breathing. Breathing in and out of your nose has a massive benefit rather than breathing in and out your mouth. We normally are conditioned and programmed to breathe with the mouth slightly open. When we sleep with the mouth open. That is basically when you're sleeping with your mouth open, you're ingesting lots of infection. If there's COVID in the atmosphere, you're ingesting it, and it's drying out your throat, it's drying out your vocal cords, it's drying out your lungs, and it's not a good thing. Okay, but if you breathe in and out your nose with your mouth closed, at first it feels weird, it seems weird, and it becomes quite difficult to breathe first. Once you're used to it, it is magical. Okay, number one, it warms and humidifies the air that goes through your nose. You've got hair in your nose, ladies. You got hair too. Okay, men just have hairier, thicker hair that protrudes out. We don't. Okay, some of us do actually. We pluck it out, but you have that hair follicles that basically it filters out most bacteria. There's lots of bacteria in your nose. Some of it gets filtered out, some of it doesn't. But what it does do, the air warms up, it humidifies your breath, and it also reduces any risk of infection. Okay, it helps you absorb oxygen in your lungs much better. Okay, it fights bacteria, and also it helps fight stress and anxiety. So when you're feeling like, oh my god, I'm coughing and I feel like I can't breathe, and you're like close your mouth. And it doesn't have to be a deep one, just normal breathing. Please practice doing that. Honestly, it's a lifesaver for me. It really is. Another one that does, I know it's going to be with your mouth open, but when I really have bad coughing fits and I can't breathe and I'm out of breath, I do try a when I'm doing I'm using my throat, and it calms everything down. Then I go straight back into. Okay, so please try and breathe in and out of your nose. Okay, what else? In the morning, cough everything out, blow everything out. I use a nasal rinse called Neil Med. That's thanks to Consuela, who recommended that to me about a year ago. That really helps, okay, to take out any infection that is in your nose and throat. Okay, so it's called Neil Med. It's about 15 quid with a bottle. I do that, and then I do my Kapalbhati, I do my Om Vilom, which is yoga breathing exercises. So the Kapalbhati is when you're here and you're breathing through your nose using your lung, stomach, and the air, oxygen is circulating in your lungs. So really, really good. Okay, another one, Om Vilom. Again, mouth is closed. Deep breath in. Hold. Finger here. Really, really helps, okay? Then just deep breathing in my nose. Deep breath in, nose, out nose. Mouth stays closed, okay? So and any kind of breathing meditation is fantastic, okay? What else? Vicks. Vicks is a good one. At night time, rub some Vicks on. What else? Sleeping. If you have the cough and you're finding it difficult to breathe, I have my pillows like this. So I have 4 pillows and I make like a wedge out of them with cushions as well. So when I'm sleeping, I don't sleep flat on my back, because what happens is the mucus, it pulls up in my chest. So I have to sleep on a wedge style, and I sleep on my side. If I sleep on my left lungs tends to fill up, so I sleep on my right. It's not the best, but it's very, very helpful. So that is a good one. Also, mask. I've been wearing a mask for 4 years. People are taking the piss out of me. I've wore it in America, India, England. I couldn't give a shit if they took the piss out of me. It protects you, okay? I don't care what people are saying, that COVID is droplets only and it's only transmitted through touching and just droplets. No. If I'm speaking and I'm outside and I'm having a conversation with someone, I'm spitting everywhere. Or it's automatic, okay? Now, some of that stuff's going to go on the person that's standing in front of me. Their spit's going to go on me, and the other stuff is going to be transported by air, and it's going to be hanging around the atmosphere somewhere. Listen to people carefully. A lot of people are saying, don't go outside, don't venture out in your garden, don't go out, stay in. Because I totally believe it's in the atmosphere. And if you wear a mask that covers your nose and your mouth, and this part around here, it's horrible wearing a mask. I can't breathe in a mask, but if you do, you are protecting yourself. You're not going to breathe in any bacteria whatsoever. Hand washing, absolutely brilliant. If you are wearing gloves, I explained to my cousin yesterday and she was like, oh yeah, I wear gloves. I haven't been out for 4 or 5 weeks, but when I wore gloves when it first started, I wore my gloves, but I didn't go into the car with my gloves on and transport all the bacteria onto the steering wheel, into the car, onto the carry bags. No. What I do when I get to the car, I take off my gloves, put it in a plastic bag, seal it, and then I go into the car, which is a clean environment, and then drive, take the carrier bags out, then wash my hands, disinfect the bags, put them back in the car. That's when I was out. Haven't been out for a long time, okay? But when you wear gloves, people are going, oh, don't bother wearing gloves. Wear gloves, honestly, but don't like if you are in the house and you wore them, picking bags or something like that, take them off, put them in a bag, or wash them or get rid of them, disposable ones, get some fresh ones, okay? But mask is really, really important. This has gone long, I'm sorry. And finally, positive mindset. If I had given up, for example, right now, the doctors have told me to have a lung transplant, and that could give me 1 year to maximum 6 years of life, okay? And I could sit here going, oh my God, you know, that's it, my life's over, blah, blah, blah. No, I have positive mindset. I don't believe that COVID is going to kill me. I believe COVID's going to just not even touch me, although it's already touched me, but nothing happened to me, because I've still got so much to do in life, and I've got so many plans, and I think positively. So I tell COVID to fuck off every single day, like, fuck you, COVID, go fuck off somewhere else and just leave us all alone, okay? And I do a lot of positive affirmations. My lungs are healed, my lungs are cured, there's nothing wrong with my lungs, I have no disease in my lungs, life is great, I've got so much to do, yeah, this, that and the other. So I bless coronavirus every day. Bless you, coronavirus. The more you bless things, the more likely they are to just kind of not be a big part of your life. Do you know what I mean? It kind of will disintegrate and go, oh, I'll just go away then. So bless all those things around you. Bless the people that are in not such a good situation around you. Bless people in situations that anger you. So, you know, bless your employees. If they're pissing you off, bless them. If your family's pissing you off in the situation that you are in, bless them. Okay? And just think that you're invincible. Nothing's going to happen to you. No one's going to touch you. This disease is not going to do anything to you or your family. And just ask for protection and blessings from the man above. So do your prayers and stay in.